The tourist brochures call this stunningly beautiful corner of KwaZulu-Natal the Valley of 1,000 Hills. But the natural beauty hides an ugly truth.
They stay with the problem not knowing that they've got a problem. That's why they are dying like ants.
The problem, HIV, the virus that causes AIDS. It is estimated that it kills 1,000 people a day in this country. Even some of the locals are starting to call this area the Valley of 1,000 Orphans. Nkosiyapa and Mzamo are two of nearly 2 million children orphaned because of AIDS in South Africa, and they are both HIV positive. The younger one, Mzamo, 6, doesn't talk much and doesn't quite understand what it all means. Nkosiyapa, 9, does, and he knows they aren't the only ones. He says, I know there are many other children at school who have HIV. Their older brother, Lindani, 15, doesn't know if he is HIV positive. He's now the head of this tiny one-room household. I feel like their father, he says. I advise them when they are doing wrong things. They do get financial assistance from the government, and for meals they walk up the hill to their aunt's house, where there are other children, more orphans. Their grandmother used to care for them until she died of AIDS. The prevalence of HIV is incredibly high here in these hills and valleys. It's the highest of anywhere in South Africa. The level of infection is the highest of anywhere in South Africa, and ironically, the level of denial is higher here than anywhere else. They deny it because of the enormous stigma associated with HIV here.
It's because people are taking HIV/AIDS as a shame. And they are not taking it as a disease like all other diseases. That's when I tell you, if you talk about AIDS, you are talking about a monster. I think that's the problem.
People don't talk about it, don't admit to it, and so go on infecting each other.
People call us the AIDS capital of the world.
Father Lagletter at the Blessed Gerard Hospice sees the result of the denial every day, the AIDS patients, many too far advanced for treatment. He says he pushes people to get tested and to use condoms, but rarely succeeds.
People say I have only half the fun if I'm using a condom, and preaching to people to abstain from sexual activity, you are just laughed at if you bring up such a thing.
The impact here in South Africa and in a number of other southern African countries has been catastrophic.
We have already seen hugely alarming declines in population in Swaziland and Lesotho, and I would expect to see the same thing happening across some communities in southern Africa. Yes, populations will start contracting.
Which, as any expert will tell you, is highly unusual. In the developing world, populations grow, they don't shrink. It is also highly unusual for anyone, especially an educated leader, to deny that HIV causes AIDS. But Thabo Mbeki did, and he was the president of South Africa. Dr. Glenda Gray runs an AIDS clinic in Soweto. She says his attitude was enormously unhelpful. It gave people an excuse to go on denying. Drugs which would have prevented mother-to-newborn transmission were scarce. It took the health ministry far too long to roll out antiretrovirals, and the supply didn't come close to meeting the need.
Around the 7 years or 8 years that Thabo Mbeki was in power, around 300,000 deaths occurred because of the government policies.
But Mbeki is no longer the president. The government is promoting a new approach to HIV and AIDS. The new health minister is openly pushing AIDS awareness.
But the leadership in the ANC who put me in power have given me a full go-ahead. I've had not one person raising an eyebrow and everyone saying, just get at it.
Repairing the damage is not going to be easy. With nearly 6 million infected people, the challenge is daunting. If there is any good news, it's that antiretroviral drugs really can make a difference. You can see it if you visit Dr. Gray's clinic. It used to be when you came in this clinic, you'd find mostly stretchers and wheelchairs, advanced cases of AIDS. Right now, when you come in here, it's hard to tell if people are even sick. All the people here have HIV and they are on antiretrovirals. And the money came from the United States government.
What I would love for Americans to know is that the money that they work really hard for is reaching people, it is making a difference, it is giving quality of life back to people, it is raising people from the dead.
Just over 500,000 people are taking antiretroviral drugs in South Africa. No country has numbers like that. And remember, there are 6 million people living with HIV, and it's estimated that for every person who goes on ARVs, another person becomes infected. The depressing truth, as one doctor put it, is that the country can't treat its way out of this epidemic. For World Focus, I'm Martin Seemungal in South Africa.